Hi, my name is Kayla Vargas, and I'm a student at the University of Kentucky, and my LCP is going to be on heart disease prevention. Heart disease prevention is the leading cause of death in Kentucky. It's actually the leading cause of death in the whole United States. The causes of heart disease is being overweight, smoking, poor diet, or lack of exercise. According to the CDC, to prevent cardiovascular disease, you can keep a healthy weight, regularly exercise, don't smoke, and eat healthy. At this time, please go to the LCP project video. Now that you're back, you can understand why regular physical activity is bolded. Because of Frank's story, we see that regular physical activity like walking can be so easily obtainable. Because it's so easily adaptable, it is easy to promote an active lifestyle. According to the study called Effects of Walking on Coronary Heart Disease in Elderly Men, we can see that encouraging the elderly or encouraging children or young people or adults to walk regularly promotes an active lifestyle, and an active lifestyle ultimately prevents cardiovascular disease. Walking is also very beneficial because it's cardio. Lowers blood sugar, helps keep a healthy weight, lowers cholesterol, lowers blood sugar, and also anyone can walk. Whether you're 2 years old or you're 90 years old, you can walk, which is why walking is so beneficial. Also, we see that in these places called the blue zones are just geographical places where people live longer because there's a decrease in chronic diseases and decrease in cardiovascular diseases. We can see that the common factors are a good diet, which is a cardiovascular disease prevention, fasting, exercise built into the daily life, like walking, good sleep, and family and community. This is all seen in an article called Why People in Blue Zones Live Longer Than the Rest of the World by Dr. Roeri. In this article, we really see that family and community help people live longer. And that's because, as an example, if you are really driven, you are going to be in a community that other people are really driven. So in a family or a community where they are really close-knit, everybody will want to stay healthy because their family and community are keeping them accountable. So, for instance, in blue zones, family and community are very well-knit, so they all keep each other accountable. This proves why a walkathon is such a great idea for the community in Lexington. One, a walkathon promotes walking, which we have already covered why it's so great for your heart health. Two, it shows events like this, community events, bring the community together. And according to the information that we saw in the blue zones, we know that bringing the community together is really important. We also see that this a walkathon can be fun for all ages, for kids, adults, elderly, or the college students from the University of Kentucky, which also shows why it brings the community together. Also, all donations should go to other measures of health prevention. But why Lexington? Why is it important that Lexington promotes this walkathon? Well, one, we have the University of Kentucky, and we have seen time and time again that the community members of Lexington, Kentucky have supported UK. For instance, the basketball games, or the football games, or Dance Blue. There has always been a lot of people participating actively because of their loyalty to UK. And that's why it's so beneficial that if UK were to promote this walkathon, because there's a higher chance that it'll be successful if UK promotes it. Also, Lexington has a #1 hospital in Kentucky called Albert B. Chandler Hospital. Why is that important? Because it is the most appropriate to do it in Lexington, because Lexington has the most prominent healthcare field in Kentucky. People come from all over the place in Kentucky to come to these hospitals because they're the best. So it's most appropriate to do it here. Also, we have seen success in events called Dance Blue. Dance Blue has raised over millions of dollars for kids in the hospitals. So we have seen that events like this have been successful. That's why the walkathon is bound to be successful because of past events that have succeeded. But what can you do about this? Well, for the sake of your health, start walking. Just walk 20 minutes a day. That's all I can really say. Just start walking. Start walking with your family. Start walking your dog. Your grandma, start walking with her. Push her to walk. Hold each other accountable. Start walking with your kids. Make it fun. Just start walking. Another thing we can start doing to make this walkathon a real thing is just start talking about it. The president of the University of Kentucky is really big on change. And the University of Kentucky has just opened a public health department. We have just implemented a new bachelor degree program on public health. So the University of Kentucky is really open on doing things more on public health, prevention of heart disease. So let's just start talking and let's just start walking.